Okay?
So I know I tell everyone I must have a lot of female hormones.
There you go.
Because I have 5 sisters, 3 of them have what's called Hashimoto's. And of course they kept pushing me many years ago to find out. Well, I don't know how many of you go to an endocrinologist, but I've been going to one for about 17 years, or 15 at least that. And every year I would gain 15 to 20 pounds. My thyroid would be fine. He would medicate me with blood pressure and cholesterol and more medications and more medications. And I would just keep gaining weight. At one time, I was literally, probably at the age of 40, I was 160 pounds. And I went up to, I finally saw a doctor here. I was at 326.
Wow.
I was skeptical, very skeptical. So skeptical that I sent a friend to the first one.
Oh, so you were at my second one.
Yes.
Okay.
But they had such a turnout that they had another one right away. And she called me and told me it was very, very good, and she was going to do it, but right now it was just too hard on her. But so then I went, and I'm still skeptical. I'm skeptic, especially when you get away from the norm. My sisters had told me you need to do something different. This guy's, your endocrinologist is just not telling you the right stuff. He's treating the wrong things all the time, but I just couldn't break away, So I come here, I sit way in the back. Back, writing lots of notes. But what really got to me is his passion. And it was, you could see his passion in his face. But there was something still in me thinking, okay, maybe, but I liked everything he's saying. And then all of a sudden what's going on in my mind is money. And what's it going to cost me? And then he went through this whole thing, and I took notes, I recorded it, I listened, I went online and researched stuff, and I came in and, you had to set an appointment with him, and I was in tears, but I could see he was teary-eyed too.
Don't give me crying now.
And he pretty much just said, I can only throw you a lifeline. And he knew how much. Hi, girls. He knew how much I was depressed, I was hurting, I hated my life. Excuse me.
It's life-changing stuff, isn't it?
But I spoke with him, had my wife come in, just to make sure I wasn't missing anything, that I wasn't getting duped, because you just never know. And I wasn't. Really, I could just see the passion on his face, and he doesn't take everyone. Because really, what he's telling you, he can throw you that lifeline, but you're going to sink if you don't use it. Have I used it? Yes. I've lost 53 pounds. And there's other ways you can lose weight, and you can lose it faster, but you're going to put it all right back on again. The amount of blood tests he took, you sent for the blood tests and stool samples and everything, and it just showed me he really means something. But again, you've got to want to help yourself. And at age 58, I have grandkids. Sorry. And I was pretty much in the grave. So he's helped. Did all the tests. He showed me. He said, "What's wrong with you, Tom? Is at least 3 different things. Your body is a puzzle." I'm thinking, well, I'm a Humpty Dumpty, sat on the wall, and how's he going to fix me? And he says he's got to take each independent part of that puzzle and fix the part of the puzzle first, and then get it all working together. And it's taken time, and I'm very impatient. I hate coming to doctors. I hate getting gas, and I hate getting haircuts. But doctors was the worst, and I'm always at the doctors, and it just seems nothing. I've been in the hospital twice, rushed in the hospital for open heart surgery. Now this is just God, but each time I was healed. The doctors were like, whoa. So I know God's got a plan on my life or something, and it was to see Him and get me healed and get me better. And He's still working.
How are your energy levels?
Energy is much better. I work a lot. I work 15 hours a day, sometimes 18 or 19 now. But I would fall asleep in my chair. I fell asleep 3 times one night, typing at the keyboard, and twice I fell on the floor. And I just had no energy. I'd fall asleep at 3 o'clock. I fell asleep driving. So I just knew I had to do something. I had an accident doing that. You know, praise God and thank God that the lady wasn't killed, but that's when I knew something was wrong. So listen to him, take notes, but I mean, literally, and I've got a long way to go. But if you would have seen me, and you can ask Aaliyah or any one of these girls in here, and by the way, they're great. What made me keep coming back was not only the doctor, but the way you're treated with the staff here. I mean, you're treated really like a princess or a king. It's unbelievable. They don't look at you like you're fat and you're ugly, and they all treat you really, really nice. And that's a big thing, part of coming back right away. You know, and if you miss, they'll call you and just see how you're doing. They're not pushing to get you in. And there was times I missed, but lots of probiotics. I'll tell you what.
What did we find? Do you mind if we talk a little bit about your
No.
case? One of the things that will drive your immune system and autoimmune thyroid, okay, which is what most of you have, you may not even know it, okay, 90% of thyroid problems are autoimmune. The doctors just don't run the proper test when we talk about that. There's usually something that's triggering your immune system to do that. One of the most common things in thyroid patients that I find is a hidden gut infection, okay? And you don't know it because doctors don't run the test. So on time we found it was a yeast infection and a parasite.
A real bad parasite.
So we had to get him on medication for that, and we had to clean up his gut and everything, because you're never going to fix the body if that's what's going on with the gut. 80% of your immune system's in your gut. So we run all the tests and we look at all that. Now he's 4 months into it. Our typical patient's 6 to 12 months. He's going to really see him in another 6 months. And he's done the work. I'm just coaching him and teaching him. And that's why I'm real selective on who I take on as a patient, which, you know, I'm going to get into, but, you know, you got to do it. But I'm going to teach you how, I'm going to coach you, you're going to get our support and everything. But it's life-changing. It's life-changing.
And I've lost this much just by what he's done to my body. I mean, it's a lifestyle change. There's food. Found out I'm allergic to glutens, bread, pastas, everything like this.
And we found
Fine.
food sensitivities on
Food
it.
sensitivities, but it's amazing. So, I mean, you know, I was just eating chicken, fish, meat, vegetables. I hate vegetables, but I ate them. No dressings, no sauces, no ketchup, nothing. No sugars, no salt, no nothing. I mean, nothing at all.
And we'll explain that today.
Lots of vegetables.
We do that to calm the immune system down. It's a temporary kind of stopgap measure we put in place right away.
But I don't miss anything. It's amazing, you know. So many people see me, and, you know, I've lost 51 pounds. The biggest thing now, I have not really worked out because I'm going 15 to 18 hours a day. Well, doctor's gotten on me, and I'm accountable to him. I'm going to do it 20 minutes a day, and that's it. And I know that you're going to see another major drop in me, because it's just, you know, now I feel healthy enough, and where I didn't ache. I mean, I couldn't even walk. My feet would kill me. I didn't want to walk. I didn't want to do anything. I didn't want to live. You know, I was just getting fed up, and I just didn't. But, you know, I went to a doctor 2 doors down for 17 years. Yes.
Well, you have like numbness in your feet.
Oh yeah.
Because she was telling me the other day that
We're going to talk all about that in the program. Yep.
Lots of stuff.
Yeah.
My body was a mess. I probably was the worst one he's seen. I'm imagining. It was really a mess.
And we're not even done with you, Tom.
And he's not done it. I mean, and then all of a sudden I found I'm only going to come here once a day.
Once a week.
Once a week.
Once a day.
Once a
Once a
day.
week. Well, once a day would be great. I stop in here periodically because everyone's so much fun, but I had tears just pouring down my eyes because they told me, Tom, you're down to once a week. I mean, it was hard. You know, you're coming 3 and you go to 1, and it's because of the way you're treated. You know, Leah's, they're all very good. You know, Leah's standing, hiding out here and things. She's very good. Debbie, Jackie, Sherry, Katie, Sue, Becky, all of them. They're phenomenal. Not one of them, you know, they just treat you like your family. That's really what it is. It's family.
Thanks, Tom.
He's not paid me. Didn't even ask me. I suggested it when we were in a meeting. I said, you know, this is a passion now. I'm telling so many people about this, but so pray about it, think about it, but don't wait too long.
Thanks, brother.
God bless you.
All right.
Bye now.
Bye.